everyone. You found Sanctuary's Coffee and Conversation Show. My name is Myrna Haskell. I'm executive editor of Sanctuary magazine. This empowers and inspires women with a focus on the arts, philanthropic pursuits, health and wellness, inspirational travel, career, culture, and community. You can find us at sanctuary-magazine.com. This morning, my guest is Melissa Glaser. She is a licensed professional counselor and founder of Timeless Therapy. Good morning, Melissa. Thank you for joining me today.
Hi, nice to be with you.
Yes, I know, and it's nice to meet you. I want to let our regular listeners and readers know because they might recognize you. Melissa participated in our interactive section, Ask an Expert, last year. I believe it was March, where she discussed, answered and commented on readers' questions about adult sibling rivalry and some issues we might have with adult siblings. And she did a fabulous job on that if you want to check that out under Guest Room, our interactive section. So anyway, but today we're going to talk about a serious topic, and that is PTSD. We're going to talk about triggers, treatments, and symptoms. And Melissa has a lot of information on this because this happens to be one of her specialties. But I wanted to start off, Melissa, with just having you explain to listeners what is PTSD, and if you can elaborate a little bit on types of events or traumas that might trigger this disorder.
Absolutely. So PTSD, post-traumatic stress disorder, is a mental health disorder or a psychiatric disorder, and it occurs in people that have either experienced a very traumatic event in their life or they've been witness to a traumatic event. It can be a one-time isolated event, or it can be a situation where people have prolonged experience where the trauma occurs, over a series of times. It really changes the brain structure, the brain chemistry, and how people perceive the world after that experience, and their visceral reactions, both emotionally and physically, to the trauma.
Yeah, obviously any sort of a real personal trauma attacks, things like that. Car accidents, I've heard lots of times, can trigger. Do you want to talk just a little bit more about what types of events and situations typically trigger this? I just mentioned kind of two, but can you think of other ones based on your experience?
Sure. We used to talk about PTSD mostly with people in the military that experienced, frontline violence, and, were exposed to events that they felt helpless, or things that were coming at them without an ability to emotionally plan for them. So, that's where PTSD really originated from. We were seeing high incidence of people coming back from the front lines, really changed dramatically and having a lot of mental health issues, having a difficult time reorienting into the community and functioning. Now, PTSD, we use it in a much more common way. Because we're realizing that PTSD really is that exposure which changes your neurological system in a way that could occur with any event that comes at you that you're feeling is out of your control. It could be violent or not. It could be leaving you with a sense of helplessness. It could be that you're in a car accident and your whole emotional, physical system really has not had time to prepare. So, the structure of how you neurologically manage after that, how you look at the world, how you perceive what's coming at you, has drastically changed. So we use PTSD as a diagnosis for people that have been in abusive relationships, people that have endured physical and sexual abuse, people that have been in traumatic situations, shootings, Yeah, car accidents for
And so
sure.
you're seeing it in children too, I'm sure.
Absolutely. Yeah, there's a high incidence of children being diagnosed now with PTSD, you
Oh,
know.
such a shame.
Yeah.
Can we, because I know that some people don't really understand some of the difference between some of these things. Like I know that we have listeners and readers who suffer from general anxiety or perhaps occasional panic attacks. So I kind of want to dig in a little bit to maybe some of the differences or similarities of like chronic stress
Yeah.
and PTSD, or perhaps like a panic attack that's not associated
Yeah.
specifically to the disorder. Do you want to just dig in a
Yeah.
little bit there?
Well, the closest cousin, if you will, to PTSD is a diagnosis we call acute stress disorder. And the difference really is that PTSD is when symptoms occur over a prolonged period of time.
Okay.
So people can have, of course, more normalized stress reactions, reactivity to a trauma or a stress, um, because that's what we would expect. And, that would naturally happen acutely, shortly after the trauma. PTSD becomes a diagnosis when it's those symptoms, those changes occur recurrently, beyond a month, usually.
Okay.
Yeah, and become almost a chronic situation.
Okay.
So, so some of the other things that you mentioned, generalized anxiety disorder, uh, those are in a whole different category, and they have a little more to do, less to do with trauma, and more to do with perceived issues that individual is having.
I see.
PTSD is
I see.
absolutely, correlated to exposure or witnessing of a traumatic event.
So in terms of the actual symptoms, though, are there any similarities? So like, for instance, if someone's having a panic attack, they
Yeah,
may be experienced accelerated breathing and their heart rate is
yeah,
accelerated and they feel closed in or claustrophobic, they're sweating,
yeah,
those types of things. Are there similar um, symptoms with the two
sure.
different? I've read about flashbacks with
Yeah,
PTSD. I think
yeah,
that may be a different type of symptom than a typical panic attack might be, right? So I guess
right.
I'm just trying to, so that our listeners can understand, a little
Sure.
bit more about the differences of some of these things that they might in their non-professional mind see
Yeah, yeah. So
immediately.
certainly, with most mental health disorders, right, it's individualized, and each individual may manifest different types of symptoms. But heightened anxiety and panic is often correlated with PTSD. But PTSD, what we tend to work with, or the symptoms that we tend to have clients coming to us with, are a heightened reactivity to events, an
Can you
inability.
explain that a little bit? I think I
Yeah,
know what you mean, but I just want to make sure
yeah.
we're all.
So that might look like somebody that has a high startle effect. Somebody comes up behind them and they're not just startled, but they their whole body shakes or moves, and then they're almost in a dissociative state. So
Okay.
people with PTSD often check out, which tends to be that they put themselves, things are so painful, they're being triggered, so they are in a dissociative state. It's almost as if they're here, but they're not really present emotionally.
Mm.
Um, People with PTSD will, often say that they're unable to sleep. Nighttime, when things are quiet, there are few distractions. That's often when somebody will be triggered. They'll have recurring thoughts about the event. They'll have flashbacks maybe, and a flashback is when you are really viscerally feeling like you're re-experiencing the traumatic event all over again.
Oh,
And we call it triggering because, often it comes at a time that you're, not expecting, you're not prepared for. It can come because you hear, a loud noise that reminds you of the experience and brings you back there.
Mm.
It can come from a sight or a sound. Sometimes
Smells even probably, right?
Sometimes
Wow.
dates, sometimes it's, seeing somebody, across the room or on the street that has some, similar, look that, is similar to somebody that brought on the trauma. Sometimes it's turning on the news and hearing about a similar event. So,
yeah, let me ask you this, because
yeah.
that just made me think of something. So, of course, 9/11 was an event that our entire country experienced together.
Right.
Those folks in DC and New York City who had loved ones that were stuck in buildings or on planes and that kind of thing were extremely indirectly affected by it, right? But I mean, did you ever see or hear about situations of PTSD just with people who, as you said, were watching what was going on in the news?
Mhm.
Now maybe they hear, a plane overhead.
Yeah.
And it's triggering something even though they weren't actually involved in the trauma.
Yeah.
That's fascinating to me.
It is. We have become a culture where there is that 24/7 newsreel, right? And if people are not aware of what it can do to continue that, watching that over and over again, it is exposure. It may be from a distance, but it is continued exposure, and it does change, how things start to react neurologically. So, we are much more careful now to say to people, you need to limit what you're watching. You need to not expose your children to, watching those violent acts or those traumatic events. But it's easy to turn on the news at any time and, to see it right in front of you, almost as if it's occurring in real time.
Right.
Yeah.
And
yes, that can
no, go
cause
ahead. I'm
PTSD.
sorry, Melissa. What were you going to
So
say?
that can cause PTSD.
Yes,
Absolutely.
yes.
Yeah.
And I know that we mentioned children, and I think I heard you say that with PTSD, it's recurring. It's something that's more chronic, lasting at least a month.
Yeah.
Have you found, because I'm hearing that the person is really just experiencing the trauma over and over and over again
Yeah.
with this.
Yeah.
So is it that the more frequently the person is experiencing the trauma and having these flashbacks, does it get like worse and worse and worse over time? I mean, I know we're going to talk a little bit about coping mechanisms in a minute, but just in terms of like general studies that have been done on how long it lasts, a month to 3 months to years, what have you typically seen on length, children perhaps versus adults, or with really serious cases, do they tend to last longer? So I guess I just want to dig a little bit more into length of time.
Sure. Most of the studies now are showing that 7 to 8% of all adults, have experienced some form of PTSD. And it really is about treatment. So if, somebody is getting appropriate treatment and working the treatment and staying with the process, being consistent, then the body, the mind heals. It doesn't take away the traumatic event, but appropriate treatment will help reprocess and put that event and the reactions to it in a more acceptable, manageable place. And also appropriate treatment is going to help somebody learn the tools and strategies that they need so that they don't necessarily have those full-blown flashbacks or triggers, or if they begin to occur, they know what they need to do to help themselves.
So do you
go
mind
ahead.
elaborating a little bit on some of
Yeah.
these strategies and tools, and perhaps let us know, based on your experience and folks you've worked with, what you found has really helped in terms of coping with the symptoms?
Sure. Therapy is vital, right?
Okay.
And sometimes people need medication along with therapy. But CBT, cognitive behavioral therapy, is often the mode of treatment. And now, we incorporate, therapists that are really in tuned with trauma-based therapy. Will incorporate all kinds of mind-body techniques, or will refer the client to some of those other alternative therapies
I was
along with
going to
the
ask
CBT.
about that,
Yeah.
because it can be such a sensory sensitive thing that the person goes through in terms of the triggers, right?
Yeah.
Have you heard that from clients that things like, aromatherapy or
Yeah.
breath work or like some of these other things, obviously cognitive therapy, which is what you're offering, is
Mhm.
extremely important, talking about it, getting through what happened, talking about the triggers, talking about the situations when they have the
Mhm.
flashbacks, right?
You
But
know,
is there anything in particular
yeah.
that you've seen help that's more alternative in
Yeah,
that way?
so I certainly learned, in my work at Sandy Hook, where I was in charge of all the community recovery, right, that talk therapy is uh, very helpful and instrumental at the right time. Sometimes when people are in the acute throes of the trauma, they're dysregulated and they're not able to talk through what they need to. They can't even put into words, what they've experienced. So, acupuncture, yoga, meditation, um, you know, uh, sometimes, a gym membership where, they're able to release some things physically, but
Yeah,
also
so
strengthen
physical
their brain.
exercise helps as well.
Right, right. And
That's
there's a lot of
probably a
different
way to relieve
aromatherapy.
anger as well, too, right? A healthy way.
It can be, sure. So, often we'll prescribe some combination of those things. But EMDR, which many people have heard of, it's eye movement desensitization reprocessing, is a um, widely used form of treatment
I've heard of it.
for PTSD, and it has to do with eye movement, and the therapist that is administering it, creates a rhythm and allows the client's eyes to fall into what we would call like a REM sleep pattern. And we know that, eye movement is directly connected to the part of the brain that holds memory.
Is it
So
a type of
process,
hypnotherapy?
no,
Is it in that?
no,
No, it's the actual movement of the
yeah.
eyes.
It involves very little talking, right?
Okay.
But there's a lot of prep that goes into the therapist, working with, the origin of the memories that are causing the PTSD, and creating supports around that. But yep, it has to do with just eye movement, eye gaze, holding that gaze, and allowing those memories to come out and then to be reprocessed or reframed in a less negative way.
And
So
that reframing that's done in various ways, I'm sure, throughout all of these therapies, is that usually sort of the segue to recovery? In other words, once the person can start to
yeah,
not, it's probably like a freight train hitting
yeah,
them when it starts to happen, right?
it
Because
can
I
be.
heard you mention that with talk therapy and cognitive therapy, sometimes if the person is in the midst
Mhm.
of, you know, the reenacting, maybe you might want to say, of the trauma, the triggering the trauma all over again,
Mhm.
that they get into a state where just everything has to be brought back down. But I'm just wondering, in terms of like long-term recovery,
Yeah,
have you seen some patients seem to be recovered after some
absolutely.
therapies, but then it comes back? Or
Well,
is it generally if you reframe and you can finally get to them to a point that then they seem to be in a more permanent state of recovery, I guess
yeah.
I'm
So,
wondering.
we know we don't erase memory, right? It's there. We don't erase experiences. Um, so it is, yes, it is about, being able to put those memories and experiences in a place in the person's mind, in their body, in their life, that is manageable, or that they're feeling like, okay, I understand now what has occurred and how I've processed it, I can move on. So, I often will say, in terms of education, it's as if you had a physical trauma. Let's say, you fell, you're in an accident and you broke your femur. Nowadays, we don't just, you might have surgery, maybe there are pins and rods that are put in your leg. We don't just send someone home and say, okay, you had your surgery, don't move until it's healed. What we do is we send someone in that situation to rehab, and rehab includes physical therapy, occupational therapy, emotional therapy. They learn, that their leg is changed forever. It's going to heal, right? But they have to learn now how to adjust their body. They have to learn, what their limitations are. They have to learn, sometimes how to, stand or walk all over again. And it's a process,
Yes.
right? Their leg is changed forever. They're going to have that rod in their body now that they didn't have.
I like that analogy a lot,
Yeah.
because I think it also brings back this idea of how strong the body and mind are connected, right?
And you learn how to adjust. So, someone in that situation too might learn that, look, you have limitations now. And if you push it, right, you're going to be in pain. If you push it, you might re-injure or cause more damage. And you need to know where those limitations are and, what to do if that pain is coming on, or if you're getting close to that. That's what we do in therapy. Right. So somebody is experiencing an emotional trauma, we have to teach them, how to move forward when their life is altered now, how to make those adjustments, how to know what their limits are. The limitations might be, look, you can no longer watch movies that have a presence like that. You can't be in the company or presence of the person that abused you because it's going to trigger you. It might mean that we teach them more self-care. If you take on too much, your stress level is going to get high. Your inhibitions are going to be diminished, and you're likely going to have some triggering. So
a lot of it is the self-care piece as well, then, because we talk a lot about that at Sanctuary, and how lots of times women in particular don't take the time for the self-care because they're always caring for other people. So I would imagine with something like this, the aftermath of trauma, that self-care is just, it's really become something that you need to keep in the forefront of your mind every day.
And with a lot of people, yes, you have to teach them to recognize, when they're not taking care of themselves, and that it's important and they deserve it, and they have to stay healthy. With that analogy of, somebody that has a broken bone, if they just say, I don't have time for all of the therapy, I'm just going to take medication. The medication will mask the pain. Eventually they'll get up and walk on or go back to work, right? But, they haven't learned what they need to preserve, the damage
long term too,
right? So chances are they'll do something to re-damage, themselves, or the pain will keep reoccurring and they'll have to keep taking more medication.
Melissa, what types of medications are given for this? Are they anti-anxiety type prescriptions?
Oftentimes it depends on where the person is in the symptomology, right? But SSRIs are often used. So if somebody has, really heightened anxiety, it would likely be something like that. If somebody is really in a deep, despairing, dark place, we would look at some antidepressants, or maybe a combination for sure. Part of PTSD, it's very common for people to isolate, to think nobody's experienced what I am, nobody can understand where I am. The world is not a trusting place anymore. at any moment something bad can happen again, and they isolate. So isolation often leads to depression.
Yeah.
And then we have to treat the depression.
And then yeah, wow.
Yeah.
And it sounds to me like how people experience this disorder is very, very different. And there's a huge variety of ways they experience. And so the same goes for the treatments. It's very individualized, it sounds like, depending on the person's individual experience, right?
And I can't express enough, it's a process, right? So
Yeah.
we have an epidemic of, people that have addictions. And many of those people are self-medicating because of trauma experiences, because of PTSD, because they haven't, found the right treater or given themselves the ability, the permission to go through the process. And, they self-medicate, and then it becomes an addiction.
Right. And now you're piling on additional problems with the person from the original trauma and the aftermath of that. Yeah, thank you for all of this information, because I know that a lot of people really don't quite understand what the disorder means, and they use it more loosely, in sort of in layman's terms, not really understanding exactly what it is. And so I really appreciate you sort of digging into some of the details for us today. But I wanted to give you a few minutes to talk about your services, because I know that you treat people with other situations. I know that you also have a book out that's about healing. So if you'd like to say anything about your book, now's the time.
Thank you. Yeah. So I have a group practice in Southbury, Connecticut called Timeless Therapy. I provide clinical services. I have 7 clinicians that work with me, and all are highly skilled, different areas of expertise. We have 2 clinicians that are certified in EMDR. We have clinicians that specialize in working with children or adolescents, and grief and loss, and certainly trauma. So we provide services both in the office and remotely.
Yeah, I was going to ask you about virtual services, because that's really been growing, particularly after the pandemic, right?
Yeah, it's interesting. So people are now more and more asking to come into the office, but we provide an array. There are people that can't, and out of, convenience or even proximity, it's nice that we can service people that are a little bit further out, because they can do their sessions remotely. And a lot of people that are working from home that are able to take a lunch hour, and do their session remotely. But we have a beautiful office that's, very trauma informed and welcoming. So that's where we're at. We accept most insurances.
Oh, that's good. That's good.
Yeah. And
well, thank you. What about your book? You want to say anything about your book? Because I know we did link it for those listeners that want to go to the Ask an Expert section. We linked it there. But if you'd like to say something about that now, that would be great.
Yeah, just quickly, my book was my experience in working with the Sandy Hook community after the school shooting. So I was hired to be in charge of all the community recovery about 1.5 years after the event. And I, chose to write a book about our experiences, so that other communities could use it, and other clinicians going into this work. And it really has been informative for many communities. I get calls now all the time, unfortunately. There's no shortage.
I know it's going on and on, right? So the book is still extremely in the here and now because of these horrible situations that continue to happen.
Yeah, so the book is called Healing a Community, Lessons in Recovery After a Large-Scale Trauma. And it can be found on Amazon. But yeah.
Well, thank you so much for your expertise and for your words of wisdom about this disorder, and for filling our listeners in on things that I'm sure they are new to them to learn about the disorder. So I really appreciate you joining me today.
My pleasure. And your magazine is, so helpful.
Oh, thank you so much, Melissa. That
So
means the
many.
world to me. It really does. And I'm sure the rest of the team as well. So thank you for those words. I'll close as I always do by wishing all of our listeners and our readers good health, happiness, and continued inspiration. Thank you so much for joining us today.
Thank you.